2, 1.
Good evening. Welcome to everyone. I think we have 9 attendees here already with us, watching us. And we're here to present an open evening session which tells you about our clinic and what we have to offer. I'm Dr. Abha Bhatt. I'm one of the consultants at Herts and Essex Fertility Center. I'm joined with Jackie McAdam, our senior fertility nurse, and Marna Marks, our marketing manager, who has been working tirelessly to make this evening happen very regularly and very smoothly. So let's begin. So we're going to start with a presentation that gives us basic information about the clinic and end with a virtual tour of our clinic. I would like to apologize that there is no sound with the tour, with the video because of the Microsoft Teams software. We would be happy to provide you with a link so you can watch it with the sound in your own time. The Q&A session would be ongoing throughout the session, and Jackie would be answering all the questions, and we would not leave any question unanswered before we leave this session. We would welcome any feedback you may have for us, and we would provide you with the link on how you can provide feedback so we can make this session more helpful, more informative to you, and hopefully we're thinking of making it back to the in-person open evening so that we can see you face to face, you can see us face to face, and maybe even visit the clinic and have a feel of how we work and what we have to offer. About the question and answer session, please look for this icon, which has a question mark within it, and it says Q&A. Please don't click on the chat. Any questions that are posted on this Q&A icon will be answered. And the question, you can post anonymously or you can have your name, and we'll answer all your questions. The microphones and cameras have been switched off just to make sure this goes smoothly and for my benefit, I guess. So just a little bit about ourselves. This Herts and Essex was initially founded as the Essex Fertility Center back in 1989, and we moved here in the year 2007, which is when the name was changed to Herts and Essex Fertility Center. So we have over 34 years of experience, and well over 7,000 babies we have the credit of helping over 7,000 babies conceive. All the procedures are performed under one roof, and we have a state-of-the-art purpose-built clinic. You don't have to go for any part of the fertility treatment anywhere else. Everything is done within our center. So we have the entire range of services that are required in a fertility treatment scenario, starting from assessment, evaluation, tests, and treatment, all the way up to ultrasound scans to confirm pregnancy. And we would take care of you up until just before 12 weeks of pregnancy. So starting with fertility assessments, depending on the type of assessment you choose, maximum of 2 visits would be required. Before you have the assessment, you need to register yourself, and then you come for the first visit, which would be with one of our nurses or HCAs who would do your BMI and a blood pressure check, take your blood tests, or help you give your semen sample for testing. And the second visit would be for the assessment, depending on what you have chosen. So let's talk about that in a bit. So this table gives you a very brief and salient features of different assessments. Say, for example, if you're a couple and want to have everything tested in one go, you can opt for the couple one-stop. So we would do the blood test as well as urine test for the female partner, the semen analysis for the male partner, and then followed by, on the second visit, this ultrasound scan to assess the uterine cavity and the tubes. The female one-stop doesn't have the semen analysis and is really for single women who are trying to get their fertility assessment done. Female mini fertility is a really very uh, myopic look at the assessment, and we only concentrate on the egg reserve in this. So we would do a blood test for AMH and do a scan to basically check the uterus and the antral follicle count to corroborate with the AMH. We do also offer to do HICOSY, which is a ultrasound scan to specifically look for whether your tubes are open or not. Currently, there is up to a 9-month waiting list on the NHS. So if you're waiting on the NHS for HICOSY, you could potentially come to us and have this done so that that waiting period of 9 months is cut short and you can move on in your fertility treatments. So 3D ultrasound assessments include a 3D ultrasound scan to look at the uterus and both the ovaries. We can count the number of antral follicles, which give us an idea as to how well the ovaries are doing for the egg reserve. We can also assess the uterine cavity by means of saline infusion sonogram. So if you can see this picture, this is that of a uterus which has been injected with saline within the cavity, which has enabled us to pinpoint this polyp which is growing from the inside lining of the uterus. We recommend that this polyp is tackled before you have any fertility treatments. And in order to do this, we have to insert a thin tube within the uterus so that we can inject the saline. The same tube can be used to inject a different kind of fluid, which enables us to look at whether or not your tubes are open, and that test is called HICOSY. In case we find a polyp or any growths arising from the muscle of the uterus, which are called fibroids, or if we see that your tubes are swollen and therefore will impact the success from your fertility treatments, we would recommend that you have corrective surgery to optimize your chances of pregnancy from any treatment that you undergo. And this can be managed. We can help you deal with all those scenarios. Whether this be through a hysteroscopic surgery or a laparoscopic surgery. Hysteroscopy is when we use a camera to go inside your uterus and take care of the polyp or any fibroid that may be growing into the cavity of the uterus, or in case the fibroids are growing within the muscle of the uterus, or if there are any swollen tubes that need to be taken care of, that will have to be done through laparoscopic surgery, which is done through the belly button. So there are two ways of having treatment. You can either have a fertility assessment, and if on after fertility assessment we suggest that you need fertility treatment such as IVF, and then you book a consultation with us, and we can talk to you in detail, explain you the risks, the costs, and answer any questions that you may have, and then proceed with the treatment. You can also forego the fertility assessment and directly book a consultation to speak with one of us, and we can then help you get the relevant investigations done later. And this is especially true in those of you who may have already had some of the tests done, or who may have had an IVF treatment done already and are looking to having a second round of treatment. So before the consultation, you need to register online, and this is followed by a pre-assessment where a nurse would take observations for both you and your partner. We would do blood tests for AMH and thyroid for the woman, the female partner, and then for the man will produce a sperm sample, and that all these tests are we would have results to all these tests. They are processed well before the consultation is due. And the consultation is not in person, but on Microsoft Teams. In case you would prefer a face-to-face appointment, that's fine too. But most people prefer an online consultation because it saves you the trouble of having to come all the way here, and time management is so much easier. You can even attend the online consultation from 2 different places if you're at work. And the consultation lasts for an hour. If you have to go through IVF treatment, we would encourage you to download our app, the Salve app, which all of our patients are absolutely delighted with, because it helps you get information about your appointments, reminds you when your next appointment is, reminds you when your next medicine is due. You can get information about the medications that you've been put on, and even ask us questions through secure messaging service, and we can help you get answers to your questions without you having to be at the end of a phone waiting for someone to pick up or answer back. Anyone who's trying to get pregnant, I think because of the social media information that is there on social media, everyone is becoming more and more aware of how important it is to be fit, not just physically, but in mind, and lifestyle can go a long way in helping you manage this, and you can get more information about how you can be the fittest you can be through this website called fitforfertility.com. There's a lot of information available on diet, what kind of exercise you can do, and basically have a much more healthy lifestyle that would put you in a better better place to have the best outcome from the fertility treatment that you're going to have. Before you have any IVF treatment or even IUI treatment, both you and your partner would be expected to have blood tests done. Where it concerns IVF, the blood tests, the screening tests as they are called, needs to be within a 3-month period. And this is as per the regulations of HAPA. And these tests should be from a UCAS accredited laboratory and include HIV, hepatitis B, hepatitis C, chlamydia, and additional tests for the female partner who's undergoing the ovarian stimulation include AMH, which is a blood test to check for egg reserve, and also for rubella antibodies, which would indicate whether or not she has the immunity to fight rubella or German measles. We would also check the female partner's full blood count to make sure she's healthy enough to carry the pregnancy. Intrauterine insemination is one of the basic fertility treatments that is offered initially, and as the name suggests, it means we are going to pick out the healthiest available sperm from within the sperm sample and introduce it into the womb cavity. Now, the way it works is that you can choose to have it in a natural pregnancy or, natural cycle, or you can have intrauterine insemination where you're taking medications to boost the ovulation so that more than one egg is released and thereby increasing your chances of pregnancy from an IUI treatment cycle. It does, however, also increase slightly your chances of having a multiple pregnancy. It would be best used for couples who have psychosexual problems, who have the female with vaginismus or the male partner having impotence or premature ejaculation or any other erectile dysfunction. Single women who are looking to use donor sperm can use IUI to get pregnant. Similarly, same-sex female couples can also use donor sperm in order to help them conceive. So they will need infection screen, counseling, they need to consent for the procedure, and then they're all ready to start with IUI. In the IUI setting, there is no time frame, there is no validity of the blood test, the screening blood tests that are required. We would monitor you on the scan to pinpoint when your ovulation is likely to be. And you would also be advised to have ovulation kit. So if you have a surge on the ovulation kit, we would do the IUI the following day. If you don't, and on doing the scan, the biggest follicle reaches 17, 18 millimeter size, we would give you a trigger injection to cause ovulation to happen and use that to time your IUI, and which would be 36 hours after the trigger injection. Egg freezing is becoming increasingly popular because of our lifestyle and because of how hard it is to find the right person to have a child with. And if you're in a place where you are concerned about your fertility and want to preserve it for future, you can consider doing egg freezing. And in this, what is done is you would have medications to cause the ovaries to produce more follicles, where we take eggs from your ovaries and we freeze them and store them in liquid nitrogen. Success rates are very good because of the techniques that are now available for freezing the eggs. And previously, the HFEA had a limitation of 10 years, which made life very difficult for those who wanted to do egg freezing. But now that they've changed it to 55 years, anyone who's concerned and wants to preserve their fertility for future has a very good option available to them. The younger you are, the better the egg quality is likely to be, and better your chances would be of being able to conceive in future when you're ready to have a child. Apart from social reasons, those who have a family history of early menopause can consider doing egg freezing. Those who have been diagnosed to have cancer and are due to have chemotherapy or radiotherapy that is bound to have an impact on their fertility can also have egg freezing before they have any cancer treatment. Surrogacy is when somebody agrees to become pregnant and have a baby for someone else. And we are one of the largest centers who do surrogacy in UK. And here there are two parties. One is the surrogate who carries the pregnancy, and the other party is the intended parents. This is often the only option available to women who are unable to carry a baby to term because of either a previous hysterectomy or any other surgeries because of which the uterine anatomy is distorted. Say, for example, multiple fibroids in the uterus and things like that. Similarly, male same-sex couples can also have only this option in order to help them complete their family. There are two types of surrogacies. One is a full surrogacy or host surrogacy, where the intending parents create embryo, and this embryo is then transferred into a surrogate. So the surrogate has got no genetic link with the embryo that is implanted. The other type of surrogacy is a partial surrogacy or straight surrogacy, where the surrogate's eggs are used to get her pregnant. There are lots of changes underway, and hopefully with the changes that will be made to the current law, it would become more feasible and more easier for people to have surrogacy in the near future. Moving on to IVF. So IVF takes about maybe 9 to 12 days of medications, which is followed by egg collection. On the day of egg collection, the male partner gives a sperm, and using the eggs and sperm, the embryos are created. These embryos are cultured, and the best one is used for transfer to help the couple have a pregnancy. So to talk in more detail of IVF, it starts from either the second or third day of the cycle, and you have a scan to record how many follicles there are in the ovary. So if you see this scan picture, this is an ovary, and each of these black bubbles are follicles. You start having the first medication, which can be anything like Bemfola or Gonal-f, or there are so many of those. And they contain FSH, which is follicle stimulating hormone. Some of them may have follicle stimulating hormone and luteinizing hormone. These are the two hormones which are required to make these follicles grow. So you have these injections from the second or third day of the cycle, and we continue to do your scans every 3 or 4 days. As the follicles in the ovary respond to the medications, you're going to start feel some side effects, which may include headaches. You may have mood swings. Once you're nearing the egg collection stage, you may experience some breast tenderness and bloating and heaviness in the pelvis as well. So once the follicles start growing, you will see that the lining of the uterus, the inside skin of the cavity of the uterus, starts becoming thicker, and you can see this is a trilaminar or a 3-layered appearance of the endometrium or the lining of the uterus. And once the biggest follicle gets to 12 to 14 millimeters size, we would ask you to start taking a second drug, which is going to be in the morning. And this has to be taken at the same time every day. And this is designed to stop you from ovulating prematurely. And we continue this evening injection, which is going to help the follicles to grow further, and we monitor the growth. And once the biggest follicle is ready for egg collections, between 18 and 20 millimeters size, that's when you have the final injection, which is the trigger injection. And we would give you verbal and written instructions with regard to what time you have to do, and the egg collection is done 36 hours later. On the day of egg collection, you would be admitted to the recovery bay about half an hour before the scheduled time of egg collection. We record your baseline observations. The male partner would give the sperm sample, and egg collection is done under sedation. And once the procedure is completed, which takes roughly about 30 to 40 minutes, we wait for you to recover from the sedation and discharge you. It should be over within 2 to 3 hours at the most. So that is the whole treatment cycle. And that day, the day you have the egg collection is the day when we create embryos. And how we create embryos depends on what your specific circumstances are. It may be IVF, ICSI, or PICSI. So IVF is done when the male partner's sperm analysis meets the 1999 WHO criteria, which is 20 million sperms per ml of the semen. 50% of them minimum should be motile. The normal form should be at least 15%, and the percentage of sperms that are mature on the HbA assay should be at least 65%. In case the sperms don't meet this, we would recommend that you use ICSI for creation of embryos, and in this, the embryos, the sperms are injected into the each of the mature egg. This may be offered also in those who test positive on the MAR test, meaning they may have anti-sperm antibodies which prevent the sperm from causing fertilization of the eggs normally. ICSI may also be offered to those couples who have had normal sperm count, but on a previous IVF cycle had either a low fertilization rate or no fertilization. So this is a video of ICSI, where you can see this is one of the sperm, and this is the pipette which is going to be used to take the sperm and use it and inject it into the egg. So in order to do that, the tail of the sperm has to be flicked, and this causes immobilization of the sperm, and this is a very important step before the sperm can be injected. Without this step, the sperm will fail to fertilize the egg. All right, so now this is the shell of the egg, and this is the sperm, which is now being injected into the egg. This is a mature egg, and we know this by looking at this structure. So that is the sperm there now going in. And we do this to every mature egg that we have, and put the eggs back in the incubator the same morning, same day of the egg collection, so a bit later, after a couple hours or so. So PICSI is the third technique that we can use to for fertilization of the eggs, and this is offered in those couples where the mature sperm percentage is lower. So if the number of sperms which are mature is less than 65%, using a normal ICSI would not cause fertilization to the acceptable level, and therefore PICSI would give you a better chance of having a good fertilization rate. And it is said that if we use immature sperms in ICSI to cause fertilization, this may affect the embryo quality and may put you at a slightly higher risk of miscarriage. So once we've done the fertilization, we put the eggs back and we look at them the next day, which is when a normal embryo should look like this. So there should be two structures within it, and we call them pronuclei, and they represent the genetic material of the egg and sperm, one belonging to each of them. And they then fuse, and the cell now starts dividing, 2, 4, 8, so on. And then by this third day, it should where it can vary anywhere between 6 to 12 cells, the ideal cell number being 8. By day 4, and the numbering starts from the day after egg collection. So day 3 is 3 days after egg collection. 4 days after egg collection, it should become a tight ball of cells. We call it morula. And by 5th day, it should become blastocyst. So the tight ball of cells spreads into 2 parts. One remains a tight ball of cells and will eventually form the baby, and the rest of the cells align themselves in single layer on the inside of the shell and would eventually form the placenta. Before this blastocyst can implant, it needs to hatch out of the shell, and you can see an empty shell here, and this is a fully hatched blastocyst which is all set to get to implant, and we need to transfer the embryo or freeze the embryo by this stage. We can't keep the embryo beyond this stage in the laboratory. So the last day on which we can do your embryo transfer is the 5th day after egg collection. There might be some embryos among what we have in the lab that are growing slightly slower, and we are happy to give them another day to reach the stage of blastocyst. So any supernumerary embryos that reach the stage of blastocyst on day 5 or day 6 can be frozen, so that you can use this for getting pregnant in a future attempt. We do embryo transfers all 7 days a week, thereby ensuring that we do embryo transfer at the time that is best for you, and therefore maximizing your chances of pregnancy. When we do the embryo transfer, we give you an opportunity to see your embryos, and we also give you a picture to take away with you. We offer the add-on treatment called embryo glue, which is a transfer medium which mimics the condition present in the female uterus at the time of implantation. And there are several studies which suggest that this can improve the chances of pregnancy. We offer the whole entire range of pre-implantation genetic testing, including PGT-A, meaning testing for aneuploidy. Now, what aneuploidy means is that the number of chromosomes that are present in an embryo has to be normal for the embryo to be able to implant. So sometimes the eggs may have one less or one more chromosome, occasionally the sperm too, but this leads to the embryo having an incorrect number of chromosomes, and that condition is called aneuploidy. PGT-A can help us identify embryos which have the normal number of chromosomes versus those which do not. So we can now pick out those embryos which have a normal number, and therefore will not just give you a better chance of pregnancy, but also minimize your risk of miscarriage. There might be couples who have genetic conditions that are prevalent in their family and are worried about their child suffering from those. So we can plan to have the embryos tested before they are implanted, such that only those embryos which would not put your baby at risk of having, so only those embryos which do not carry the condition which would cause this disease can be chosen for embryo transfer. Similarly, there are couples who have structural rearrangement. So the genetic information is complete, but there is a rearrangement in the way the chromosomes are present in their cells. And when they make their eggs or sperm, there is an imbalance which is possible, and this makes them prone to having multiple miscarriages. So in those couples, we can choose only those embryos again, which have either a balanced translocation or are completely normal, so that your chances of miscarriage from those imbalances are minimized. we have RI Witness in our lab, which helps us tag every sperm, egg, and embryo that comes into our lab. Everything is electronically tagged, and this provides traceability to every lab procedure that is done. It helps us prevent human error so that the right egg and right sperm are used to create the embryos, and the right embryos are used for transferring, so that you can rest assured that no mistakes will be happening, and we can use AI to our advantage in this way. Once you've had the embryo transfer, about 12 days later, you would be having a urine pregnancy test. In a fresh cycle, if in case it's a frozen embryo replacement, we would do a blood test after 12 days. And if this is positive, a scan is done 3 weeks after the positive test. And we are happy to do this test and confirm that the pregnancy is normal, and rule out ectopic pregnancy, make sure it's a viable pregnancy so that you're assured. And we're happy to take care of you up until 11 weeks and 6 days of pregnancy. During this time, in case you have any concerns, any bleeding, any pain, we are happy to review and scan you and reassure you, hopefully, and advise you according to what's happening. Apart from the self cycles, which use your own eggs and sperm to create embryos, there may be many who require donor eggs or donor sperm. It might be because of age, early menopause, previous cancer treatment, or a previous IVF cycle, which has suggested that the egg quality is poor. You may have been advised that you need to consider egg donation for that. Again, egg donation is also required for same-sex male couples, for obvious reasons. Sperm donation may be required where the man isn't producing any sperm, or the testes have failed because of a previous cancer treatment or because of genetic disorder. Single ladies and same-sex female couples may also opt for sperm donation in order to help them conceive. We have a contract with several PCTs for doing IVF treatment, and these include Mid and South Essex ICBs. From all these areas: Mid Essex, Castle Point and Rochford, Basildon, Brentwood, Thurrock and Southend. Similarly, Barnet, Camden, Enfield, Haringey and Islington. And we can do your IVF cycles on the NHS. In case you do not have funding for NHS funded treatment, you can consider other options, including egg sharing, sperm sharing, and freeze-in sharing. Freeze-in sharing is for those ladies who are considering egg freezing for future fertility preservation. So you can choose to freeze half of the eggs that are retrieved after an IVF cycle. All our fertility treatment costs are on our website, and we're a completely transparent organization with no hidden costs, very, very upfront with what we charge and what you can expect, with no sudden surprises coming in later. We have packages for egg freezing. So if you opt for a single cycle of egg freezing, that would cost you approximately 3,900. This is not including the drugs. In case you opt for a 3-cycle package, that would cost 8,750. And if you're not sure, you can just pay 3,900 for the first cycle. Second cycle again would cost the same. And in case you need a third cycle, then you would automatically be considered for the 8,750 package. So you would only pay the balance amount, which amounts to just over 900 or something like that. So, you don't have to decide upfront for the 3-cycle package. We are able to offer treatments through Access Fertility, which is an independent financial institution. They offer IVF Unlimited, IVF Refund, and multi-cycle packages. And you can go on their website for more information. And okay. So Marna is working tirelessly, providing positive vibes, support through all our social media platforms, and we really believe in giving emotional support to all our patients. And I think that is one of our strong points, that our patients feel that they are supported throughout their IVF treatment. They never feel that they've been left to negotiate the fertility journey on their own. All their questions are answered. We offer three sessions of supportive counseling to everyone who's undergoing fertility treatment with us. And we really believe that emotional wellness is really, really important for this to work. Those who are trying to achieve a more optimal weight can go on the website of the Association of UK Dietitians. We had a dedicated dietitian before associated with us, but I think she's unable to take on new clients at the moment, and which is why we recommend you to go on this website and find a dietitian that you feel would suit you best. Why us? I think we've already mentioned our long, over 34 years experience. We offer a 7-day-a-week laboratory service, so you're not going to be not allowed to have a weekend embryo transfer if that isn't the best for you. We have an electronics witnessing system which prevents human errors and which ensures that the correct gametes and the correct embryos are used for your treatment. We have a long track record and would support throughout your treatment and provide emotional support as well. We would post the survey link, and we would really, really appreciate any feedback that you can provide us. Help us figure out how we can make this better. How can we help this session be more helpful to you, answer any questions that you may have. And I hope you've been asking a lot of questions and keeping Jackie busy. And please stay connected with us through all our social media platforms. We have less than 2-week wait currently, and you can book an appointment by calling on 01992 78 50 60, and the lines are open between 8 a.m. and 4 p.m. Monday to Friday. You can also email us on inquiries@heartsandsexfertility.com. The appointment, including AMH, thyroid function test, and semen assessment, along with a consultation, would cost £400. I'm going to take leave from you, and I hope you have had some useful information from this session. I'm going to start the virtual tour now, and again, I apologize, there is no sound. I'm going to stop sharing this video for that. Okay. It was wonderful to have you all with us. I believe there are some questions. I'm going to answer them before we leave, so please bear with us. Thank you.